Hello, good afternoon, everybody. It's good to be here. A quick introduction. For those of you who don't know, I'm Eloise and I'm the founder of The Ribbon Box. And today we are very privileged to be speaking to Emiliana, who is the founder of the Mindful Birth Group, and she's joined now. So I'm going to join her in and we're going to be talking about how to prepare for birth. Welcome. Should be here any second. Hi, Emiliana.
Hello, how are you?
I'm very well, thank you. How are you?
I'm good. I'm in my bedroom with a weird light, so I'm much more kind of, I don't know, orange than you.
It looks absolutely fine to me. It's so nice to be connected to you today, talking about how to prepare for birth. And could you just start by giving yourself an introduction and what you do, and yeah, then we'll go from there.
So I'm a mum to Molly and Theo. Molly's 7 and Theo is now 4. I live with my husband and the kids in Tring in Hertfordshire. And I'm a mindful birth teacher, antenatal courses and postnatal courses. And I also founded the Mindful Birth Group, which essentially is antenatal courses for parents, but also a training academy for teachers to teach those courses as well.
Amazing. And sort of the clients or I guess clients that you see, or people who take advantage of your courses to help prepare themselves, what stage of pregnancy are they normally at?
Yeah, so I mean, it's never too early or it's never too late to take a course. This is such a hard question to answer, but one that everyone asks. But essentially, people do tend to aim to take them between the 24 to 30 week mark to give them plenty of time to practice what they learn, but also find out more information, because often they find that everyone's situation is unique. So they often have to kind of then go and delve into a bit more, perhaps with their midwife or other sources as well.
Absolutely. And I guess part of what we're going to be chatting about today is that it isn't too early to be preparing and thinking about your birth plan, is it?
No, not at all. And a lot of it is letting it all sink in as well, which might sound a little strange, but if you start kind of thinking about it right before the birth, that can be quite overwhelming. So actually letting yourself ease into it once you find out you're pregnant, and can start thinking about how can I start preparing my mind and body right from the beginning, really.
Amazing. So the first thing I want to talk about is sort of care and planning. How can we be proactive in our sort of prenatal care, and knowing, as you just mentioned, when's the right time to sort of talk to a midwife, a care team, get expert help and support in preparation for birth?
Well, it is recommended to book in your first appointment with your midwife pre-10 weeks, because they do a few tests and take your stats and things and get you kind of into the system, so to speak. So that's pre-10 weeks. So you obviously then have that in with a kind of medical pet care provider. But, you can gain support in other places too, whether that be through like a course that you're going to take. Some courses like ours would offer that support right from the beginning. Perhaps a doula, so a birth or postnatal doula. Would be someone that the sooner you book them, the more support you get. So people do think of them as quite expensive, but actually if you were to book it in your 12th week, you'd get so much more support from them rather than booking in your kind of 34th week, and it's the same price, so to speak. So there are lots of different places that you can get support, whether that's kind of the medical side or the more emotional and physical side of it too.
Do you find that people's sort of I guess planning changes as their pregnancy continues?
Yes, I think so. I think I'm definitely seeing that people are thinking about it a little bit earlier. But I suppose I see a lot of panic booking as well, though, where people sort of think, oh, I haven't ticked the course box, I must book a course, because that's what everyone does at, way too late, kind of 34, 35 weeks when baby's just about to come. And like I said, it is never too late. It's much better to have the information and that support at any point. However, if you're thinking about it earlier on, just go for it, because you'll gain so much more for it if you do it earlier.
But do you think that people might come into it maybe at an earlier stage of their pregnancy thinking they definitely want a water birth, or they definitely want to do X, Y, and Z, and then they change their mind as the pregnancy progresses?
I see. Yes, definitely. I mean, when we talk, we don't really talk about birth plans because I think that can really give a false expectation of kind of what happens. Not that we, you know, we want to be negative and say, well, that's never going to happen if you put that on paper. But actually, if you do think that, you know, like when you're at work, you write a plan for a project, don't you? And then that's because you want to tick everything off, and it goes to how, you know, that how it needs to be delivered, and you get praised if it's delivered in that way. Whereas birth is very different, and actually putting together a set of preferences as to what's important to you versus what could change on the day, and also if this scenario happens versus if that scenario happens, what's your preference there, is going to help you, one, maintain that and actually carry that through on the day. And a partner, you know, any birthing partner that's with you, help support you with that too, because it'd be quite hard for them to be saying, no, she wants this and that's the only way it's going to be.
Yeah, I completely agree. If anyone has got any questions for Emiliana as we're chatting, please do throw them out there. We're so lucky to be speaking to you, so thank you. I know that you said that you don't really talk about birth plans, but so that people are aware of options,
Yes.
for things that are specific, like a water birth, what's the best way to prepare for that, if that's something you're interested in, and find out whether it's the right fit for you and the baby?
Yeah, so I mean, definitely speaking to your midwife is a great start to talk about what happens. And if you're planning for a home birth, and I say planning because obviously you do need to plan for that, there are certain things that you do need in place, but it's also thinking, if that doesn't happen, how do I make the transition to a hospital smooth and everything as well. But particularly talking about water birth, if you're at home, you do need to kind of either buy, hire or borrow a birth pool. So that would be something that your midwife would be able to help you with too, and maybe recommend someone in the local area who hires them out, or there are big companies as well that do that too. Some areas even loan them out as well. Definitely local doulas, I know, do that. So there's definitely different ways that you can get hold of one. Or if it's your preference in the hospital, then yeah, you would just or a birth centre, you would just let your midwife know ahead of time that you're planning to go to the birth centre, and then obviously on the day have that written on your preferences, and make sure your birth partner knows that too, so that you can go to the right place.
Yeah, of course. Do you see lots of people coming to you for support and for your courses, for example, who may have experienced loss and things like that, where it's obviously very triggering, and so they want support throughout this process and the lead up to preparing for birth?
Yes, absolutely, and more than ever, and particularly with, you know, difficult fertility journeys too. And we've actually got training in place now for teachers coming on board to support with that, because it is sadly something that we do have to support with a lot. And I would say that in essence, the preparation isn't any different in terms of what you need to do. It's more about how your mindset is. Having perhaps had a lot of medical intervention too, it's very natural for people to think, I do not want to risk anything or do anything, but it's really important to kind of go open-minded, still find out your options, as everyone would. But I know it's a lot harder for people who have had a struggle to get pregnant in the first place, to have that open mind.
Absolutely, and as you're aware, and people watching may know, I founded Fertility Help Hub, which is kind of the sister Instagram account at the moment, where people can find fertility resources. So it makes sense to be having these conversations, because so many people want that support following perhaps having assistance, whether having assistance or not getting pregnant, but there isn't a huge amount of support out there for people who have. Once you've had all that sort of hand holding through your treatment, then suddenly, whatever the outcome be preparing for the next stage of your journey. So I think it's brilliant that you are training people to give that support.
Yeah, because there's definitely a way, and the language used and things is different.
Absolutely. Now, could you tell us a little bit about the signs of labour?
The signs of labour. Okay, so when I go into this part, I want to just stress that this is different for everyone. So if I reel a list of things off, it's not that this is how it's going to happen for everyone watching in this order, in this way, because that's, I mean, most of our course we say, but it's different for everyone, because it is. But the things to look out for, or, you know, you might experience, are contractions, so waves starting. I like to call them waves because that's kind of what it is. They kind of build in intensity and kind of come back down again. And with those, people often say, "Are they Braxton Hicks or contractions? How will I know?" And it's really about the regularity and the intensity. So Braxton Hicks or practice waves would be quite sporadic and not hang around. Whereas, where perhaps when things are starting a bit more, it's going to be a little bit more regular, and you're going to see that little pattern to them perhaps. And particularly early labour, this can start and stop as well. So it's not that once you start feeling something regular, it might actually tail off. And that's a really important thing to remember, because often people think, oh, what's happened? Something's wrong. Why isn't it carrying on? I'm doing something wrong. But actually, it's just the body taking a rest, because particularly if it's the first time your body's done this, it needs to rest and it needs to kind of recover as it builds up and warms up. It's very clever. It kind of knows that it needs to do that when it does need to do that. Mm-hmm. So the best thing to do is to rest and to give your body that break, and to try not to panic and go into overdrive, because you're going to need that energy much later on for the actual birthing part. So that's one sign. Another one could be waters breaking, releasing, which is only actually about 4 or 5% of people have that as their first sign of labour, which is really low compared to what you might be led to believe by films and the TV. Mm-hmm. Of course it does happen, but it is a low percentage. Normally it's about the tightenings that people feel. But waters releasing or breaking could be that gush of water, but often it is a bit of a trickle, and it feels like you've gone for a wee and you can't quite stop, but it's still kind of trickling away. So you definitely feel it'd be quite different. And your underwear might be a bit damp, and things are. If you imagine that it's like the amniotic sac is like a balloon, and baby is kind of still plugging the cervix, which is at the base of that balloon. However, when they move a little bit, they let a little bit of water out. So sometimes it could be a little bit that comes and then it stops, and then it comes again as baby moves position. Or if baby's still bobbing around, it could be a bit more of a steady flow. So just understanding what's happening inside can help someone kind of picture why things might happen.
And is it important, if you feel that your waters have broken, is it important to try to get medical assistance straight away?
No, not necessarily. So the guidance is definitely depending on hospital trust, because different hospital trusts go by different guidelines. But normally, if nothing else has happened, so you haven't felt any tightenings or anything within either 18 to 24 hours, somewhere like that, they would normally ask you to go in to be monitored and just check everything's okay. You don't have to do that, by the way. It's completely your choice, but that's what the recommendation would be. But in between that, up to that time, they recommend you stay at home and just let things play out, really. Okay. Yeah. Okay. They'd be the two kind of the key signs, but that you've also got your mucus plug coming away, which is at the cervix, and it's at the top in between baby's head and the cervix, and that comes away either gradually or in one big gloop. But again, it sometimes can still be up to a week before anything even starts to happen with that one. So a positive sign, but again, just something to kind of know that it's okay.
And just going quickly back to the sort of fertility treatment side, and for people who may have had assistance, is there anything, or complicated early pregnancy, is there anything that they should be specifically aware of in terms of preparing for birth?
Again, like kind of going back to really being kind to themselves as to what journey they've been on, and so what effect that might have had on their perception of what's to come. Because if you look at it in kind of medical terms, there's no stats to say the pregnancy going forward from 12 weeks would be any different. And that obviously it's very individual. It depends on people's risk factors, but generally, particularly after assisted pregnancies with IVF or anything similar, that actually then things continue okay. So it's trying to change the mindset of, I've had to have assistance to get here, so I must have to have assistance, or I must have to do something to make sure it's all okay from here. And that can play havoc with the brain or the body, because the brain's constantly on overdrive and adrenaline and, just worried and scared, which is totally understandable. But at the same time, that can be not very helpful for when it then starts to kind of going into labour. And we want you to enjoy the pregnancy, because it can be an enjoyable time, minus sickness and all the kind of other things that come along with it. Yeah,
it's a funny one, isn't it, pregnancy? Because at the time it can feel like a long time and very tiring, and all of the other side effects that you've just mentioned,
Yeah.
issues with sleep and sickness and heartburn, all sorts of things,
Yeah.
and anxiety around birth. But then when you're not pregnant anymore, do you
Yeah.
find that lots of people feel that they miss that, the thought of
Yeah.
not being
Again, it's so individual, and I wouldn't want to pinpoint that pregnancy is enjoyable for everyone and it's not for everyone. It's such an array of different experiences, but yeah, some people do say that they miss it because people are nicer to them. They get a lot of nice attention, and it's a very different experience being pregnant versus not, with a nice bump and that kind of thing. But then some people just really don't like it at all, so yeah.
It's amazing what the body can do. And then in terms of the second trimester, what kind of movement can we start building in as a good foundation for birth prep?
Yeah, so I mean, you've got the absolute basic of kind of just gentle walking each day. It doesn't have to be miles and miles. It could just be round the block. And I love saying to people about listening to affirmations in their headphones, as they just take a 10-minute walk around the block each day, perhaps on a lunch break or after work, just to get one, fresh air, but two, to get the body moving, because the blood flow, that's trying to get to baby, it's growing a baby, it's not focusing on the rest of you so much. So that movement is really important, but also signing up to something like a yoga or Pilates class helps with both mindset and the body, really, because often if it's a pregnancy specific one, the teacher will be talking about and this is a position in birth that can be quite helpful, and you can start connecting with the way your body might be more comfortable during that time, and start just thinking about it, which if you don't think about it until you actually get into the birthing process in that situation, it can feel really overwhelming. So just gently building that into your kind of weekly routine. And we do offer that with our courses. That's why we do, because we've got weekly yoga online for everyone from 12 weeks because of that.
And how can people access your course? We're putting the link up in our bio for anyone who wants to check it out. But can you tell us a bit more about the support that you offer and your courses?
Yeah, so thanks for putting it up in the bio as well. But yes, we can basically, there's a few different options people have. So you can take your course as a group. It's important to some people to make friends or take a course in a group scenario, and that can be done in person with your local teacher, or online on a Zoom session, or you can take a course privately too with any of the teachers, again on Zoom or in person. So it's really trying to make sure everyone's got the best option for them. But as I say, you get your course, which is an 8-hour course, plus all of the extra benefits, which include the movement, the relaxation, Ask the Midwife online group as well. So knowing that midwives are, they want to be able to give that emotional and practical support as well. But we all know when you get to your appointment, you have got a limited time, and often it's running over. So it's hard to ask the questions you want to. So we have that as well.
That's really useful, really useful. And I know that you offer mindfulness as well, don't you, as a tool?
Yeah, so in the courses, there's a whole session on how you use mindfulness tools for all births. So this is not about trying to kind of zone in and focus on achieving a particular type of birth. It's absolutely not that. It is about learning tools and techniques that can apply to all scenarios, particularly if things aren't going how you imagine them to go.
Yeah.
Which is often, unfortunately, but it doesn't have to be a negative thing if you're prepared to kind of deal with that step by step.
Okay, that's really good to know. We talked about the key stages of labour, which I know that lots of people do have questions around. And what about planning if you're going to pivot what you're doing and suddenly, your birth plan or what's happening to you changes?
Yeah, well, the biggest thing is to know that you can ask questions. So if things aren't going as you expected or weren't pictured in your head or on your piece of paper, ask questions. Say, well, if something else is being suggested, perhaps an intervention of some kind, it's just making sure you understand what that is and you feel confident in yourself that yes, that's the right thing to happen next. We often think that anything unexpected is going to be a big emergency, and it's not going to be time to decide these things. But honestly, that it's so rare that it is such a big emergency and things are too quick. It's normally that a doctor or someone or an obstetrician would need to, anaesthetist would have to be paid, put into place. It can take hours to anything to happen. And so actually making sure you feel comfortable in your decision and what's being offered is the very first thing that you should be doing. So there is an acronym called BRAIN. Have you heard of that?
Yeah, I have actually, yeah.
Oh, yeah. Which is a helpful kind of framework to make sure you know all the information you need. So B is for what are the benefits, R of what are the risks. So everything has a benefit and a risk, or lots of benefits and lots of risks. And it's important to have a balanced view of whatever it is that's being offered. It could be an epidural, it could be an induction, it could be anything. Or it could be, moving into hospital from home because the midwife suggests it for one reason or another, whatever that might be. A is then for alternatives. Are there any alternatives that you could consider as well? Maybe you want to try that before you try the thing that's been suggested. Then I is my favourite. What's your intuition saying? Because once you know all of the above, that's such an important part of your decision-making process, because it's not black and white for everyone. Hospital trusts have guidelines. They need to, because it would be impossible for them to work. But they aren't right for everyone because they're so black and white and down the line. So sometimes people need to deviate from that straight line. And that's okay. That's not illegal. That's not allowed. It's just about parents kind of taking that on for themselves, which I know can be scary in itself, but it's important. And then N finally is for nothing. What if you were to do nothing and wait or decline? But what's the implications of that? I'm so passionate about that one because it's birth trauma comes from feeling out of control, not understanding what happened to you, and having kind of this blurry image of trauma and fear. And so by really ensuring you kind of understand everything every step of the way and agree to it and consent to it, that's going to hopefully reduce that likelihood for you too.
Yeah. Do you have a lot of people asking you for advice throughout the courses in terms of, is an epidural right for me? Should I be in the labour ward? Can I look at doing it naturally?
Yes, and we never ever say to someone, this is the right thing for you, or you should do this, or you should do that, because you just never know until the day. You don't know how your birth is going to pan out and unfold, and that's a good thing too, because it just doesn't happen that way. So the best thing is just be have that confidence, and that's what hopefully the courses instill in people, is confidence to ask questions and know that they can make decisions for themselves too.
Mm-hmm. Absolutely. What about after the birth? So postpartum can feel so far off. It is known, isn't it, as the fourth trimester. So what's your advice with preparing for that part?
Yeah, so we have a whole 90-minute session just on preparing for postpartum, because it's a whole other ball game from the birth, and we do think of the birth as one day, but it is postpartum will be related to how your birth went, and so it is a continuation, and it's very important to us that we prepare parents for that too. Going to kind of just leave them to then kind of go on, because I used to hear so much that people would say, I prepared so much for my birth, but I didn't do any preparation for postnatal. So that's all built in now into our courses. And the things people can be doing are really thinking about, what support do I have in place? So that's not necessarily just it's not just childcare. It's actually support for you as well if you have other children, or who's going to walk the dog for me, who's going to be doing the weekly wash for me, who can just pick that up for one day for a few weeks, do all the washing and drop it back to me, all ironed and everything. And I know it sounds like some people think, oh God, I could never ask anyone to do that, but honestly, it's not forever. It's going to help you so much just to let go of everything and just focus on your healing and recovery, which long term benefits you and everyone around you.
Mm-hmm, absolutely, because I'm sure people kept saying to me, sleep when the baby sleeps, or babies, because I have friends as well, but that's not always possible, is it?
No, we don't actually say sleep when the baby sleep, but definitely rest, chill out. Don't the housework can wait. And I know that actually stresses some people out. I had no problem with letting the housework wait, but I do know it does stress people out when it's all messy around you. So who can you get in to help you with that? And if people are going to come, give them the Hoover.
I was hoovering I was
Yeah,
hoovering after a C-section with twins to make the house look nice for people coming to visit, which
yeah.
really set back my recovery, and it meant that
Mm.
yeah, probably I was probably recovering from my C-section for 6 months,
Yeah,
and I
and yeah.
regret that.
Yes, and that's the thing that we keep sort of saying to people, and it is hard to imagine, isn't it, that you are going to need that long, or just a bit of hoovering is going to really hold back your recovery, but it does. Hiring a postnatal doula is something that I think more people are hearing about doulas now, and it's becoming less of something that a celeb might do. It's actually something that, you know, some cultures and countries have it as a given. You know, some governments pay for doulas. Like
Amazing.
it's just something that should be given to every single new parent, which we do include a postnatal doula session in our courses, but unfortunately it's not in the house, it's just on Zoom. But we can definitely, you know, talk through any concerns people have about baby care, or you know, just feeding baby, winding baby, putting baby in a carrier or a sling, anything that's going to make things easier for them, basically.
Mm-hmm. So that sort of expert go-to, so that you know, if you're questioning how you're doing it or feeling sleep deprived and just want some answers, that's where to go.
Yes, exactly. And I think we're finding that people are just wanting to maybe talk about the birth as well, in a way that is not being judged. It's not being, you know, no one's trying to kind of fix it or brush over it for you. It's just kind of download it and debrief it almost, to someone who can listen and not kind of butt in and say, well, my birth was like this, and you know, that kind of thing, because that is all part of the healing process too, the mental side of postnatal recovery.
Absolutely, I couldn't agree more. So to finish, what would be your top 3 takeaways, must-haves or do's?
So yeah, I'm less of the stuff, I'm more of the do's. So definitely education, you know, educate yourself on your options, whether that's a course with us, a course with someone else, whoever, but a book, whatever it might be. Just find out what your options are, for birth and postnatal too. The movement side of things, you know, keep your body moving, whether it's gentle walking, getting fresh air, as and when you feel like it. And then the relaxation side, so really just imagining that pregnancy is time for pampering. And that doesn't have to be going to expensive spas. That's building your stuff into your day-to-day routine. So at night time, using a nice facial oil, or putting on a candle whilst you do a nice jaw massage, because your jaw is connected to your pelvic area, and that can really get
Really?
sore during pregnancy. And if your jaw is tense, your pelvic area is probably going to be tense too. So those little relaxation things, having a bubble bath if you like them, just getting those rituals in place, which you can also use during birth as well if you want to. But yeah, the relaxation side during pregnancy, and I guess self-care is a bit of a buzzword, but it's looking after yourself, and making sure that will only help your postnatal recovery as well, if you're feeling relaxed going into
Absolutely.
it.
Absolutely. Such great advice. Thank you so much for coming on
Oh,
and
you're
chatting
so welcome.
about it. And please head to our link in bio to find out more about the Mindful Birth Group and the courses and the support that you guys offer, which is phenomenal. So I know we've got an article that we're going to be doing together soon. So really, really looking forward to getting that out there and supporting more people with, preparation for birth at whatever stage they're at, or after birth.
Thank you, Eloise. Thanks so much for having me.
Lovely to chat to you. Have a good evening.
And
Bye.
you. Bye.